Causes of anorgasmia and its natural treatment.
Anorgasmia is a pathological condition more prevalent in females than in males, where an individual finds it very difficult to achieve orgasm, or does not achieve orgasm at all after sexual activity. Anorgasmia can affect the psyche of an individual negatively, that the individual becomes frustrated and irritated. Anorgasmia is mostly seen in postmenopausal females. There are 3 types of anorgasmia, which are primary, secondary and situational. Primary anorgasmia. This is quite common form of anorgasmia in females where the female has never achieved orgasm. Secondary anorgasmia. This is a condition in which the female gradually over a period of time loses her ability to achieve orgasm after sexual activity despite adequate stimulation. This can be due to many factors, which may be revolving around in her mind, like work stress, depression, excessive alcohol intake and estrogen deficiency. Situational anorgasmia. This is a condition in which a female is able to achieve orgasm with a specific type of stimulation. Any other type of stimulation will not bring about orgasm in that female. What are some of the common causes of anorgasmia? Anorgasmia can be considered more of a psychiatric disorder than a condition related to body dysfunction. Anorgasmia may cause temporary, or sometimes even permanent sexual dysfunction. Anorgasmia can be caused due to medical conditions like hormonal imbalance, pelvic injury, diabetic neuropathy, spinal cord injury, uterus removal and certain heart diseases. Anorgasmia is mostly seen in females who have reached menopause. Anorgasmia can be caused due to emotional, medical, and psychological causes. Emotional causes of anorgasmia. Some of the emotional causes are certain misunderstandings and conflicts with partner, which causes undue stress on the individual, leading to decreased desire for sex. Lack of an emotional connect with partner. Lack of communication with regard to sexual needs with the partner. Ignorance in sexual life. Medical causes of anorgasmia. Some of the medical causes are diabetes, and diabetic neuropathy is one of the primary cause of anorgasmia in females. Certain heart conditions. An injury to the spinal cord due to a motor vehicle crash, or any other direct trauma. An injury to the pelvic region, or in cases where an individual has had a pelvic surgery. Multiple sclerosis is a neurological disorder, which may cause decreased sexual desire and anorgasmia. Hypertension. If an individual has undergone surgical procedure like a hysterectomy, then it may also lead to anorgasmia. Psychological causes of anorgasmia. Depression is the primary cause, which leads to lack of sexual desire, which in turn leads to anorgasmia. Increased stress is yet another common cause for an individual to have a lack of desire for sex. If an individual has a history of sexual abuse as a child, then it may impact the sexual life of that person adversely, causing anorgasmia. Some of the other common causes are excessive alcohol abuse, excessive tobacco consumption, recreational drug abuse, excessive use of antidepressants. What are the natural treatments for anorgasmia? Apart from medications to stimulate orgasm, there are also certain natural treatments which have shown a lot of promise and are quite effective in treating anorgasmia. Hypnotherapy. In this therapy, negative subconscious patterns in the mind are replaced with positive patterns. This therapy is very helpful for those who have anorgasmia due to stress, intimacy issues, and poor self-esteem. Physiotherapy. There are certain exercises which are quite helpful for treating anorgasmia. This is also a non-medicinal and natural way of getting rid of anorgasmia. One such exercise is the Kegel exercise, which is a pelvic exercise which is very effective in regard to pelvic stability and helping cope with anorgasmia. Smoking cessation. Saying no to tobacco is the best natural treatment to help with anorgasmia. Tobacco restricts blood flow to the sexual organs and thus decreases the desire for sex, and hence quitting any form of tobacco is the best natural way of treating anorgasmia. Alcohol abstinence. Staying away from alcohol or taking it in moderation is also quite an effective natural treatment. Alcohol reduces sexual stamina and makes it difficult to reach orgasm. Psychological counseling. If an individual has an issue with her partner when it comes to sexual desires and needs, and is not able to communicate it to the partner, then psychological counseling is quite helpful in getting over with that, as a lack of communication is one of the most common causes of anorgasmia. Arginine. It is a herb which helps in treating impotence and other sexual dysfunctions. This herb contains amino acids and L-arginine, which relaxes the arteries and improves blood flow to the sexual organs, improving sexual desire. Ginkgo. It contains ingredients that increase sexual desire and increases stimulation. Ginseng root. This herb has shown to treat various sexual dysfunctions. Ginsenosides in the ginseng root improves the release of nitric oxide to the blood vessels, increasing the blood flow to the clitoris. St. John's wort. This is an effective natural way to get rid of depression and stress, and thus helping with conditions like anorgasmia.